The following presentation is brought to you in part by...
What the what?
Achoo! Did Billy sneeze?
Oh, I think he did. What do we do? I'm going to tell you folks exactly what to do. You need Vapo. In fact, new Vado Vapo. And get out of my house. Who let these people in?
Possible side effects include wheezing, more wheezing, even more wheezing, a terrible asthma attack, worsening asthma, worse cough, smelling like grandma, coughing like grandpa, not getting one bit better, even getting a lot worse, and not to mention death.
Son of a gun, you don't say.
Hi, I'm Dr. Watson.
Holy smokes, it's Dr. Whopper.
After seeing nearly 1,500 new babies a year for the past 15 years, I've learned a thing or two about babies, and I've heard hundreds of thousands of questions. Here are a few answers based on what I've heard, and I really hope this helps you out. And remember, if you see something unusual with your baby, snap a quick picture or take a video with your cell phone. It may be very helpful to your doctor.
Really?
Remember, your first doctor visit should be 1 or 2 days after the hospital, and in the event baby develops an abnormal jaundice, weight loss, or heart murmurs, we'll be able to catch it if you come in during that time. Make sure you don't miss this appointment. And get your vaccine already, Mom and Dad. You need to get your Tdap and your flu vaccine to protect the baby. Baby needs the hepatitis B vaccine that's usually given in the hospital before you go home. And no, this vaccine does not cause a fever. If the nose is congested at birth, this is normal. Babies have swollen tissue at birth in the nose because they absorb liquid like a sponge before they're born. Each day the swelling improves and the breathing is a little bit more clear. But if you keep ramming suction bulbs into your baby's nose, it could cause swelling and interfere with breathing. And babies don't know how to mouth breathe, so if they can't breathe, they'll usually cry all the time. And if you suspect a breathing problem, never, ever use vapor products.
Vado Vapo.
Or essential oils on your baby to assist them in breathing, like oil of eucalyptus or oil of mentholatum. These things are poisonous fumes that can actually cause an asthma-type attack in a baby. If your baby's fussy, we don't just call it colic. That's just a vague word that basically means a fussy kid. It doesn't diagnose or explain anything. But if you can't calm down your fussy kid, we pay very close attention to this, because an inconsolable baby, one you can't calm down, is always considered a medical emergency, something you need to talk to your doctor about immediately. If your baby's hands or feet are a little bluish, this is normal. It's called acrocyanosis, and we'll see it for up to 3 or 4 days, and it gets better as the baby gets a little bit older. It does improve. If your baby has dry skin, it just means they're a full-term baby. Peely, cracked skin is normal. It does not need lotion or oils. These things can cause a rash if you put them on in the first 2 weeks of life, especially when you're using junk lotions that are filled with preservatives. Sometimes babies' ankles will have cracked skin. If it starts bleeding there or it seems like it's getting a scab, you can use very little lotion there, but try not to use it anywhere else on the body. And if the belly button clamp is on the baby, I highly recommend it is not removed, because it's soft, it has round edges. If it's removed, it'll leave behind a dry piece of hard skin that looks like a miniature razor blade. It can cut the baby's belly, and we don't want to cut or scratch the skin if we can help it. If the belly button area gets gooey, just wipe it up with a moist tissue. If it smells badly, you can wipe it with alcohol just so that it cleans and dries up more quickly. Just put a little dribble on a cotton swab. And I already know the hospital nurses told you not to use alcohol, but they aren't dealing with the baby at home. And if the belly button smells like rotting meat, you kind of need to do something to clean it, and alcohol does work better for that in that situation. Some babies have a little bulge around the belly button called an umbilical hernia. Please don't tape these down or cover them with a cloth or a coin. It is very dangerous, even life-threatening if you do that. Leave them alone. And if it gets to the size of a bulge the big as a tennis ball, then you got to let the doctor know about this.
I know a guy who had a tennis ball removed. It was the size of a tumor.
And that's why people have outie belly buttons. They had umbilical hernias as babies. Relax. If you see it, it'll go away most of the time. At birth, babies have a newborn screening test. This blood is taken from their heel. The results for this test, they come back in about 2 weeks, and they go to your pediatrician who saw you in the hospital. So if you pick a different doctor, make sure they get the records so that that doctor can tell you what to do when these results return. The hospital will call you if there's an abnormal newborn screening result. So it's very important that you do not change your phone number when you leave the hospital, because if you have to be contacted in the event of emergency, this will create a big problem if that test shows there's an issue. Also, if there's any band-aids on the baby, take them off after 24 hours to prevent a nasty rash from showing up. Some babies get gooey eyes, and this is from like a little pus in the eye. So a lot of moms, believe it or not, will just dribble a little breast milk right in the eye. Breast milk has healthy antibodies, and if you put it in the eyes, it can often get rid of this kind of eye infection. Did you know that breastfed babies, when they're about 1 or 2 months old, will sometimes not poop for a week? As long as a non-pooping breastfed baby has soft, squishy tummy and is happy, there's no worries. Of course, when they do poop, they'll deposit 7 days of poop in one diaper. That's a gift. Heart murmurs are extra sounds, and these are sounds that you'll hear in the heart that are not typically things that you would hear. Unless you're told by the doctor they're normal, you need to follow up with the heart doctor if they tell you there's a heart murmur. Fevers are emergencies in newborns, but if you think it's a fever, make sure your baby is in just cotton clothing, as the super soft synthetic blankets and clothing can often overheat babies and make them seem like they're febrile, but they're not. Unbundle your baby if you think they have a fever. Put them in a onesie and check the temperature in the armpit in about 10 minutes. If it's over 99, call your doctor. Lastly, no water. Never give your baby water. If you're breastfeeding, remember, breast is best. But if you put pure water in a bottle and feed it to your baby can have a seizure and die. Tea is the same as water. Juice and honey is also not allowed. They can have poisonous bacteria in them. So don't give your baby tea, juice, or honey. If your baby gets a white substance, when you peel back the lips and you see it inside the mouth and it looks almost like chunks of yogurt or cottage cheese, this is something we call thrush. It can also cause breastfeeding to really hurt. Doctors treat this with a little medication. It's gentle. Call your doctor if you think this is happening. Lastly, for boys, circumcisions are not supposed to happen in the hospital. The risk of bleeding is higher. The risk of failing at successfully breastfeeding is also higher. Best to wait about a week or so to settle things in. And during this time, we can also assess if the baby is getting jaundiced, developing a weight problem, or having a heart murmur. That's it for the newborn.
I liked him better on PC too. Give anyone a show.
In a world where disclaimers are boring, one man...
Excuse me, Mr. Movie Trailer Voice Guy, please just read the copy in front of you.
Oh, sorry. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.
Don't forget to subscribe to our channel on SnoozeTube
And remember to like us on Facebook.
and Tweety Bird.